Good evening. I'm Dr. Tejaswini, Administrator, Shankara Academy of Vision. This World Sight Day, we at Shankara Academy of Vision have brought you together eminent experts as part of our Educate for Eye Care series. We are now live with this session focused on rehabilitation. The session would have talks by our expert panel. We would encourage those of you listening to this video to post your questions in the chat so that we can have them answered for you. We start with an introduction on vision development and how the eye works by Dr. Soumya Murthy, consultant, Department of Pediatric Ophthalmology and Strabismus at Shankara Eye Hospital, Bangalore. Then we move on to functional vision assessment by Mr. Divakar Rao, who is heading the department of Shankara School of Optometry, Bangalore. We have Miss Anita Mary, who is vision rehabilitation specialist at Shankara Eye Hospital, Bangalore. She will be speaking on early intervention. We also have Mr. Ketan Kothari, whom we are proud to introduce to. He is a disability specialist at Sight Saver India. Mr. Kothari has started his career in 1993 as lecturer in political science in RM Bhatt Knight College, Mumbai. He worked for 11 years in National Association for the Blind, India. He is involved in conducting distance education program of Hartley School for the Blind, USA, through National Association for the Blind. His best achievement in the role was for the setting up of Asia's first ever cyber cafe for the blind in partnership with Microsoft. Mr. Kothari organized a program called Independence, which is livelihood development for the person with visual impairment through Union Bank, Switzerland. In Sight Saver, as program officer, he worked for the development and monitoring of programmers in the area of social inclusion and inclusive education. He met then Prime Minister of India, Dr. Manmohan Singh, to advocate for an enabling environment for persons with disability, which resulted in additional facilities and tax rebates. In September 2021, Mr. Kothari attended UN meeting at UN Plaza, New York to monitor implementation of the Convention on Rights of Persons with Disabilities. We invite you, Mr. Ketan, to help demystify blindness. I'll be handing over to Dr. Soumya ma'am, who will be discussing further. Over to you, ma'am.
Thank you, Tejaswini. And good evening to everybody, and welcome Mr. Ketan Kothari, Divakar Rao, and Anita Mary for this wonderful session. Happy World Sight Day to each and every one of you. So we start off with the first talk for the day. I will be talking on basically how the eye works. The overview of the talk would be, I would be covering on how the eye actually develops in utero. When I say in utero, what I mean is before birth, in the womb of the mother, how the eye actually, human eye develops. The second, I would be discussing on how the vision develops in infancy and in childhood, the working of the eye. What else can the eye do? Is just about seeing or something more than that. So all this would be covered in short in the following talk. So when we look at the embryology of the eye or the human eye development, it develops as an extension of the brain, which the part of which is called the diencephalon. So it starts as a small area or a protrusion from the diencephalon. This is the magnified image of it. So it starts as an extension from this. So it continues even in adulthood as being an extension of the brain. So eye is not an structure by its own, but it's interconnected to the brain in ways more than one. So this starts off as early as 22nd day of gestation. So within a month of the human embryo developing is when the eye is started forming. So when we look at it, it develops as a small pit, eventually forming into a cup on which the surface ectoderm invaginates into and forming a lens vesicle. So by around 5th week, the early lens structure is already forming. When we look at close to 7th week is when a primitive eye is already formed, with the eyelids being actually fused together and the primitive structures of all the components of the eye being formed. At around 8th week, we see that the vasculature to this developing eye is started to develop. So by around 2 months of the human embryo, a primitive eye is already formed. By around 3rd month, the outer coats of the eye starts forming. That's what we call it as a sclera. By around 4th month, the retinal vessels grow into this structure into the nerve fiber layer. By around 5th month is when an important structure of the eye, which is the photoreceptors, start developing the inner segments. These photoreceptors are basically the receptors which help convert this light, what we perceive, into the electrical signals which are transmitted across to the brain. Then we are around 6 to 7 months of age is when the pupil, the muscles of the pupil start developing. By around 7th month, the fovea is already developed. By around 8th month of age, most of the structures are developed and there is a pupillary membrane and the lid starts to separate. So when we look at this embryology, what is important to understand is when a child is born prematurely by around 7 months of gestation, the vasculature of the retina is not complete, and this is what leads on to a condition in the child's eye, which is called as a retinopathy of prematurity. So the child staying in utero for 36 weeks or 30 to 32 weeks is important for the vasculature of the retina to be complete and the eye development to be complete. Once we know how the eye is actually developed anatomically, well, let's go on to look at how the vision develops once the eye is formed. Once the child is born, that's around 30 weeks of gestation, a pupillary right reflex starts developing. When we say pupillary right reflex, pupil is the structure of the eye which regulates the amount of the light entering the eye. And that's how we are able to receive more light in a dim illumination and receives lesser light, not leading on to a glare in a brightly lit environment. So that starts developing as early as 30 weeks of gestation. By around 2 to 5 months of age is when a blink response to a visual threat develops. That is, whenever there is an untoward movement towards a child's eye, the child is able to blink and protect the eye from a response. That develops around 2 to 5 months of age. By around 2 months of age, the fixation is well developed. That means the child is able to focus on one particular thing and hold its fixation there. This becomes very important for the normal eye functioning to happen. If there is any visual disturbance or the structural development is being abnormal and the fixation does not develop, is when we see the shaking of the eyes in a newborn. By around 2 months of age, the ocular alignment is also stabilized. When I say ocular alignment is stabilized, what I mean is even if the child, when the child is born, within 2 months, the child may have an apparent squint or the misalignment of the eye, or what we term it as a crossed eye. By around 2 months, this should become straight and the child's eye should appear straight. Anything above 2 months of age, when the child's eye is not aligned to each other and we see a crossed eye or the eye moving outwards or inwards, that's an abnormal feature and that needs evaluation. So by around 2 months is when we expect the alignment to be stabilized. By around the same time, there is a smooth pursuit which develops completely. When we say smooth pursuit, that means the child is able to follow a target. If you move a toy in front of the child is able to follow the toy throughout the extent. That is what we call it as a smooth pursuit. By around 3 months of age, the saccades are usually developed. When we say saccades, that is switching between fixation from one target to the other. Suppose you are showing a child a toy and suddenly you bring another noisy toy from the side. The child is able to fixate onto the newer toy which comes into the visual field. That's with the help of a saccade. By around 4 months of age is when the accommodation develops. When we say accommodation, it's the ability of the eye to see at near. That's usually developed by around 4 months of age. In between 3 and 7 months of age is when the stereopsis develops. Stereopsis basically refers to depth perception. We deal a little more about this, understand a little more of this in the subsequently. By 4 months of age, the foveal maturation is complete. That means the visual acuity is tending towards normal. By around 7 months is when the human eye develops a contrast sensitivity. When we look at the visual development, we also should understand how these could translate into our assessment of a child, or how we would know that these particular parameters are developing. By around 1 month of age, when we move the child from side to side, the child is able to follow it and starts regarding the human faces with interest. That is, social smile starts developing by around 1 to 2 months of age. So if the mother is carrying the baby and the baby smiles at the mother, that means the early visual development by around 2 months is complete. The next, we look at 3 months of age. When we look at 3 months of age, when the child is given an object, the child looks at the object and is able to follow it 180 degrees. That is what is developed by around 3 months of age. By around 4 months of age, the child starts grasping the things and looking at the things very intently, and also distinguishes a stranger from family. By around 9 months of age, it starts exploring the things visually and with tactile sensations. By around 1 year of age, the child is able to respond to commands, and also start imitating. So this becomes important in the functional vision assessment of the child who was visually impaired, which would be discussed subsequently by Mr. Divakar. So this development of the normal development of the vision is very important to understand, to know is this child having a delayed visual development or normal visual development. Once we understand what are the parameters which attain in children, we also should understand what is the vision development, how is the visual acuity developing. So the acuity of the newborn is very poor, which is close to 6/120, that is very close to face. So by around 7 weeks of age is when the child starts developing an eye to face contact. And the human face gives you a lot of impulses and lot of patterns for the child to follow in response to any other toy that we show on to. So the child follows human faces much better than other toys. And the visual acuity slowly starts developing and increases to around 6/9, which is normal by around 6 months of age. When we look at the graph, this is a slow progression of the visual acuity, which happens with age. The period between 1 to 3 months is very important for visual development, and there are a lot of capacities which develop or a behavior which develops around this age. So there's a rapid raise in the acuity. The child starts appreciating the contrast. The child starts developing the saccades, and possibly the functional visual behavior. All of them occur together. So 1 to 3 months of age becomes a crucial period for development. Now let's look into structure of the eye. Having understood how the eye develops, how the eye vision actually develops in an infant, we move on to understand what is the structure of the eye. This is a very basic understanding for the structure of the eye. When we look at the human eye and take a cross section of it, what we see in the front structure, which is commonly referred to as a black portion of the eye, is what we see, which is a transparent structure, which is called the cornea. Behind the cornea, there's an aqueous, there's a chamber, which is called the anterior chamber, beyond which is the iris, which forms a small opening in the center, which is called the pupil. So it's the color of the iris which determines the color of the eye. So when we say the color of the eye is brown or black, it's dependent on this iris structure. Then behind the pupil is the lens. The lens is again, lens along with the cornea forms the two important refractive components which focus the light rays which fall on the eye to focus onto the retina. The next comes important structure is the retina. Retina is the neural structure which helps in, on which the images are actually formed, and from the retina is when it passes through the optic nerve or the second cranial nerve onto the brain. So this is the basic structure of the eye. When we talk of the eye transplant, what we are telling is only in terms of a corneal transplant, not the entire eye. That is important to remember. Now, looking at the functioning of the eye is akin to a camera. When you look at the camera, the important structures are usually a lens. We have got the aperture, whose size of which determines the clarity of the image and the width of the field. And we've got the film on which the image is captured, and the black pane, which helps in scattering, preventing the scattering of the light, improving the resolution of the image. Similarly, in the eye, we've got the cornea and the lens together functioning, playing the role of the lens, helping the image focus onto the retina. Retina, which is which acts like the film of the camera, helps in capturing the image. And then we have got the diaphragm, which is basically by the iris, and the choroid and the RPE pigmentation, which helps us to absorb the excess light. So the image which is formed in the retina is similar to a lens. Those of us who have seen the camera in the initial stages with the film inside, the film is usually a negative. It is usually in the reverse way. Similarly, in the eye, the image, the rays from the top of the object and the bottom of the object are focused onto, so that the object is formed reverse, or the image is formed reverse onto the retina, which is further processed through the optic nerve into the brain. Now, what we normally hear as beauty lies in the eyes of the beholder. Is it just the eyes or something beyond? So that goes with the saying, there is more to things than what meets the eye. When we look at the eye per se, unlike the camera, which stops at the level of the film, where the image is formed onto the film of the camera, in the eye, it does not stop with the image formed under the retina. It goes beyond. This is the structure of the retina, where we've got the cells, which are basically rods and cones. Rods are the cells which help us see in the dim illumination, while the cones are the cells which help us see in the bright illumination, also helps us to perceive the color. Through these rods and cones, via a series of cells like bipolar cells and ganglion cells, the extension of the ganglion cells forms the optic nerve, which reaches onto the brain. it is not just about the direct connection from the eye to the brain. The right and left eye are also synchronous with each other. Going on to say is the left half of our visual field is perceived by both the left eye and the right eye, the temporal half of the left eye and the nasal half of the right eye. And this images or these fibers cross on at the level of the chiasma, and so thus that in such a way that the right optic tract carries the left half of the visual field and the left half of the visual field carried by the right optic nerve. And from there on, it goes on to the radiations, optic radiations, and reaching the visual cortex. So this entire system is called the visual system, not just the eye per se. Now let's look at what else the eye can do apart from perceiving. What we have is called the cortex is visual cortex is not an independent structure, but is also connected to other structures via dorsal pathway and ventral pathway. We just not only recognize the object, we also know where it is. We also know what it is. So that is because of the intercortical connections, which helps us understand this better. Further, there are other important visual attributes that is to be remembered in terms of binocular vision and stereopsis: color vision, contrast, a parallel processing. When I say parallel processing, what I mean is when we look at the object, we not only see its form, we not only see its color, we are also able to understand is it a static or a moving object. We also understand the distance from us to the object. All of this happen through separate pathways and happen parallelly. That is the beauty of the entire visual system. It also helps in visual organization, perceptual consistency. It also helps in gaze stability and balance. It also performs some higher visual functions like reading, visual recognition, memory, visual perception, visual construction as well. The most important attribute of the human eye, or having two eyes, is the binocular vision. When we look at this image, this is the when I say binocular vision and stereopsis, what I mean is basically these are two dissimilar objects. This is the image seen by the left eye, this is by the right eye. When we see it with both the eyes, we are able to simultaneously perceive two dissimilar objects. Not just that, we are also able to fuse two similar objects which are incomplete in a way, which is called substitution, and we are also able to get the depth of the image. That's called the depth perception. If you look at this image, we normally see the stone along with a tree. When we also know the distance between the two. How this is obtained is basically because the left eye captures a different image and the right eye captures a slightly different image. The slight retinal disparity is what gives us a three-dimensional vision. It also gives us the very good binocular visual field and also some amount of monocular field beyond this. This binocular visual field is what helps us in depth perception. Next, we are also able to perceive things simultaneously. Like there are too many things in this picture, but we are able to perceive all of them together, which is called simultaneous perception. So that is also possible because of this intercortical connection. When we look at the color vision, how we perceive the color is basically because of the cone cells, which are three primary colors: red, blue, green. And depending on the color absorbed and reflected is how we perceive the colors. The last part of it is with respect to if the image is moving or we are ourselves moving. Even in either of the conditions, we are able to perceive the things better. That is primarily because of connections between the visual system, the cerebellar system, and the inner ear system or the vestibular system. So all of this together helps in perceiving the motion, helps us maintain the vision and motion. So to conclude, development of the eye, though complete in utero, acquisition of various functions happen postnatally and dependent on various factors. Eye functions more than just to recognize things. It helps in performing various activities as well. Thank you. Once we've understood the brief insight into the development of the eye and the vision development, we move on to understand about functional vision assessment. I hand it over to Divakar to start the session on functional vision assessment.
Thank you, ma'am. Thank you all of you for giving me this opportunity. Today I'll be talking about functional vision assessment. And myself, Divakar, HOD for Shankara College of Optometry. Shankar Eye Hospital, Bangalore. So, what is visual function? It is basically the amount of vision used by the person or a subject in different situations and in a different daily task is what we're going to assess is visual function. So in this coming slides, I'm going to talk about how visual function is assessed. So what is the purpose of assessing visual function is to determine what a child is seeing and to evaluate the range of child's vision, and also to provide the basis for instructing a child basically on compensatory teaching and how to overcome. We are going to train the subjects on this. How do we assess? There are a battery of tests which are required to be done in assessing visual function, such as visual acuity, contrast sensitivity, color vision, visual field, fixation, eye tracking and eye scanning, and saccades and pursuits. So I'll be going through these tests. How do we perform? First, visual acuity, especially in when we are assessing functional vision in children's or pediatric age group, we use LIA symbols. If the child is not able to perform LIA symbols, we use LIA gratings. And here we have recorded a video how visual acuity is assessed by using LIA symbols. Here the examiner is showing the distance visual acuity chart, which is kept at 3 meter distance by occluding one eye, and ask the subject to read what is there on the chart. And by this, we can record the distance visual acuity for both distance for right eye and left eye. Same way, contrast sensitivity, we use hiding ID charts. If the child is able to perform better, we can use Pellier-Robson chart. Otherwise, we use a hiding ID chart. So we have a video on how do we perform a hiding ID test. So here the examiner is showing the hiding ID chart and the subject is able to point out the chart. And the next test is color vision. For color vision, here we use HRR pseudoisochromatic plate. And this is done for near, and we do it monocularly. In this video, you can see how the test is performed. Examiner is asking the subject to close one eye, and the subject will point out at the targets, and we'll be able to identify the color vision for both right eye and left eye. So we perform this test monocularly. So next is visual field. How do we assess visual field? By using LIA wand or an arc perimeter. If the child is not able to perform arc perimeter, then we use LIA wand, which is more convenient way of assessing in pediatric patients. Here the examiner is performing the LIA wand test. So we do it monocularly. The target is brought from periphery to close and ask the patient to look at, identify when the light is seen. And same way it is done horizontally and also vertically up and down. And in the other way, it is also performed in the other eye. So you can see the child is looking towards the left to the target and identifying from the top and from the bottom. So we record the visual field where the child is able to perceive. Next test is fixations. We check fixations by CSM method, that is centrally steady and maintained. If the light reflex is not centered, this is done at 40 centimeter distance, where we give an accommodative target. And if the child is not able to maintain this steadiness, we may record it as unsteady. And if the child is not able to maintain with both the eyes, it is recorded as unmaintained. And if the reflex is not in the center, then we record it as uncentered. Next is tracking and scanning. This is to make the child to follow the target. And this is performed at 1 meter distance. And the child has to respond to it. If the child is not able to respond to it, we use a illuminated target. Usually it is done from a non-illuminated target. If the child is not able to perform, then we go towards an illuminated target. Here the child was able to perform with the illuminated target, non-illuminated target. So we can see how the test is performed. And we are showing the target for the child to look at it. And you can see the test is performed and the child is able to follow the target, in which direction the target is shown. Next, pursuits and saccades. Pursuits and saccades can be performed by wolf wand, or if you don't have another, you can use finger puppets. And this is done with the Einsuku scoring method. How pursuits is performed, we can see here the examiner performing. First, the examiner is making the child to be aware of the procedure, so which is two different targets. And later on, the test is performed. And you can see here the examiner is holding two puppets, finger puppets, and asking the child to look at the target with the different colors. And based on that, if the child is moving the eye or the head is perceived. And this is what we're checking saccades. And right now, we're checking the pursuit where the target is moved clockwise direction, around 20 centimeter away from the patient. We do it for 2 rounds, and then after that we move it anti-clockwise direction. So we are also able to note if the child is able to move the head or the body or just moving the eyes. So we are able to notice that with this, and we can record it in a Einsuku method. So thank you, referencing from where we have taken this material. And I'd like to thank our team who has helped me to develop this content, Ms. Bhavya and Ms. Bhavna, and also to record these videos on the subjects. Thank you once again. Now I can hand over it to Ms. Anita. Ms. Anita will be talking about rehabilitation. Ma'am, it is over to you.
Thank you, sir. Yes. Early intervention. Identifying and providing effective early support to the children and young people who are at risk of poor outcome. It provides the quality support to the service to enhance the capacity of the families to meet the developmental needs of the child. At the same time, the skill will prepare the child to develop the adult life. And benefit of early intervention. So this service will provide the child under risk developmental of delay from birth to 5 years. And it helps the children with a disability like cognitive, physical, language, and social skill. And also the benefit of the family is to manage their kid at the level of developmental delay. And pediatric rehabilitation service. In this, we are concentrating on vision stimulation, visual skill training, teaching of concepts. In vision stimulation, the strong visual stimuli to make the infant or a child aware of the vision. At the same time, the child will get the inputs of the vision. Some of the child does not have the aware of it. It helps the infants to learn to see, and stimulate must be strong, well structured, and simple way. We have a video of vision stimulation materials which we used to give for the child. This is the material which we are making the child to aware of light and object. It is the rope light which will be showing it to the child to stimulate the eye. And smiley box, different multicolor light which child to develop fixation and following. So child used to move the eyes towards the light. Automatically child to follow the lights at the different colors. This is the material which is illuminated for the vision stimulation. Object with a ball or a toys which child day to day play with, that we can show the lights to on that to child will fix and follow this. This is the vision stimulation chart to show the child to see and with the different directions. Now we are going to further vision stimulation. How we will give the vision stimulation for the children. So the child visual function level directed, the vision stimulation program is planned with a specific stimuli and intensity, frequency and duration assigned. So at the same time, the therapy will consist of reinforcing the light reflex, dark perception, which is compressed of flashlights shined briefly into the each eyes in a complete dark or in a dim in a lighted room. This therapy will be in a play mode way, so that the child will develop their functioning level of vision with the stimulating with a bright direct light and with a dim indirect light. So that will be moving from for a cross position, so the child will follow the light and fix the light in which direction we are moving. Child used to see the light and first of all child fix the light and then follow the light when we are moving the lights towards the direction of cross position with different colors in red or in a yellow mode. And stimulation with bright and dim object also shown to the child to look at the object, to fix and follow the lights and object. A smiley box, a child look at the smiley and to respond the visual. So when I'm moving the box, the child is looking at that and smiling. She can give the response to that by following the lights and the object. This is the visual stimulation chart. Visual skill training, eye movement, ability to move both eyes together to point at target or follow along a path, focusing accurate clarity as we look from one distance to another. Eye teaming, ability to each eye to send information to the brain and for the brain to put the information together, receive one image. Peripheral awareness, capacity to be aware of but not distracted by the total visual environmental while engaged in any specific task. Eye-hand coordination. Our eye used to guide and our hand used to write and draw, make things, pour things, catch a ball, etc. Teaching of concept involves the early of specific concept. We used to teach the concept from the child born. So we'll show the videos, we'll sing a rhymes to the babies. That's the basic way we used to teach the baby for the small concepts. So child started to recognize the colors, shapes, identifying the object, sorting about the object, and finding out teaching the letters to know numbers, number concepts, and vegetables and fruits name, animals name, and sounds of the animals. When cat says meow, the child will see that and hear the auditory waves, child will use to hear the sounds. And social emotion, when I'm showing my smiley face, child will also show to me as a smiley. When I'm showing that angry face, child will be showing his face as sad. And eye teaming, based on the child development assessment, the team will be multidisciplinary team will be formed with the parents, ophthalmologist or optometrist, rehabilitation consult, vision therapist, physiotherapist, speech therapist, occupational therapist. This is Maitri Mobile Vision Rehabilitation. It is a community-based rehabilitation service will be provided at their doorstep. This is the community-based service which we are providing for the rural area. So the people or a child were not aware to come here and get the therapy. We are going there and giving a therapy for them in a bus. So what we are giving in the hospital setup, that will be reached to the people there. They will be training under the early intervention. This is the first mobile vision rehab in the world. Final word, a word from a Helen Keller. Alone we can do so little. Together we can do so much. Love your eyes. Thank you. I'm handing over the section to Ketan Kothari, sir.
Thank you, Ms. Anita, and greetings. I'm sure I'm audible and visible.
Yes, sir. Yes, please continue.
Okay, thank you. So, greetings on the occasion of World Sight Day from Sight Savers, and an interesting topic that we are going to deal with, that is demystifying blindness. There are participants who are rehab professionals or parents, and what happens is that when we go to an eye doctor and complain about our eye difficulties, they try to do their best to help us out, restore our sight, get everything organized as well as they possibly could. But there are times when all efforts lead to nothing, and the person loses his or her sight, and a very big tragedy seems to have actually fallen on that person. So many a times ophthalmologists also, due to the fact that they've not been exposed to many blind people, tell the person that, well, now nothing can be done, you know, you will have to be doing something for his or her rehabilitation. The person cannot do much. But let me first and foremost clarify this, that blindness is not, and I repeat, not the end of the world. Blindness, I would look at it as a beginning of a new life with some kind of alteration. I believe that blindness is not a limitation, it's a mere characteristic like any other characteristic. Somebody is a short person, somebody is a long or tall person, and similarly, somebody is a sighted person, somebody is a blind person. And I deliberately avoided the use of the word normal, for I believe that everybody is normal in his or her own way. So it's blind and sighted, disabled and non-disabled. There is no such thing as normal. Yeah. Now, what happens if you discover that your relative or somebody whom you know has gone blind? I can tell you from my own experience, and I am a person who was born with aneuphthalma. The vision professionals would know what I mean when I say aneuphthalma. My parents were disappointed. They almost thought that, you know, everything has crashed. But today you are seeing that I am educated, I am speaking to you and working with an organization of global repute. And so all this despite being blind. So what does this tell us? This tells us that blind people can do everything, but everything is done in a different manner. You may have learned to do a particular thing in a certain manner, but we do almost everything, but we do everything differently. And I would urge people to keep certain things in mind. There are certain myths that prevail among society about people who are blind. And I would like to first cover those myths. First and foremost, many people believe that blind people, because they have lost one sensory organ, are blessed by some extraordinary gift by God, and they possess what they call as sixth sense. Now, I always tell people that unfortunately or fortunately, I have to live with four senses. So there's no senses. So there's no question of a sixth sense. What tends to happen is what we call sensory substitution. We try to compensate for the loss of sight by using other sensory organs to their optimal capacity. And that is, again, nothing new, because it is basically the survival instinct that people possess that enables them to do this. Anybody would do. If you unfortunately were to meet an accident and get fractured in your one hand, would you stop working? No, you would train your other hand to do activities that were performed by your injured hand. This is just like that. I always believe that there are 3 A's when you are struck with a sudden tragedy or sudden shock. 3 A's are accept, adjust, and achieve. So first, when you come to know that, okay, you lost your sight and you become blind, the problem is that, there's this feeling in your mind that why me, of all people? Why did it happen to me? Could it not have happened to somebody else? But gradually, since you know that now nothing can be done, we've tried all that could have been tried, we tend to accept the reality. It's a very difficult process, let me tell you. As much as I say that blindness is a beginning of a new life, it is a difficult process and it takes time. But once you accept it, then you learn to adjust with it. Because again, as I said, survival is what you have in mind. You want to survive. There are only 2 choices in life. Either you sink or you swim. And you will want to swim the best you know because you want to survive. So you adjust with situation. And then once you adjust it, you want to be better at what you've been doing. So you want to achieve despite being blind. And that is what is a real challenge. And believe me, it's a very, very fun-filled experience. So remember 3 A's of life: accept, adjust, and achieve. This is nothing new that I'm telling you. I'm sure most of you have gone through this in one or the other circumstances. This happens all the more when we are struck with a shock of unparalleled, size. Now, why I said this? Because I'm coming to the next myth that people have in mind. Oh, blind people are extremely intelligent. They know everything. I was told once by somebody that, even when I enter the room without making any noise, the blind person identifies who I am and starts communicating. This will happen maybe once in, lifetime. It cannot happen regularly. It is not the regular thing. The other myth that that people carry is that, if you meet a blind person once, he or she will identify you by your voice. That used to happen years ago when blind people were confined to their homes because they met very limited number of people. Now we meet so many people, so obviously it may not be possible to identify everybody by voice after one single exposure. Also, Sometimes there are contextual differences. Maybe you're having a sore throat, or maybe you're meeting me at a place where I least expect you to see me. The other myth that prevails amongst the society is that blind people don't like to use the word look and see. Let me tell you honestly, I always watch IPL match, and I always watch a movie, and I always look at things in my own way, through my imagination. And I always love to see you. So there is no harm in using words related to sight when you are making a normal communication with us. The other myth that people carry is that when we speak to blind, we must speak loudly because they may not be able to hear. Very few of us are actually deaf. Most of us are have normal hearing capacity. What probably must be happening in your cases is that since there is no eye contact from our end, you think that we've not understood what you want to say. So please don't speak to people who are blind in a loud manner, but speak to them as you would be speaking to anybody else. When you're in a crowd and if you want to address the blind person, you ensure that either you tap the person or you address him directly by name or some such thing, because otherwise he will not know that you are addressing that person and you may end up receiving no response. This is not because he doesn't want to respond, but he doesn't know that you are speaking to him. And while serving food, please, and for God's sake, please don't dip his finger into food items. Because what may happen, and this has happened with me, people show me everything by hand. So obviously they soil the food and they put my hand into salt and then into a sweet item, and then they say, okay, now eat. Now you can imagine what could happen if this kind of an experience were to be had by somebody. Just do two things. Either read out the menu, or even better, if the menu is not available, describe the plate like a clock, as if chapati is kept at 3 o'clock, rice is at 12 o'clock, in these ways. And while going for a buffet, try to take the blind person along. Don't make his choices, because you may end up things that he doesn't getting him things which he doesn't want to eat. So it's better to take the blind person along so that he or she gets what he or she wants to eat. While guiding a blind person, please offer your arm if you are guiding him indoors, and let him walk a step behind you. And while you are guiding him in public, you can offer your arm, let him walk behind you a half a step, and try and walk yourself towards the traffic. Because if you make a blind person to walk towards the traffic, it may lead to danger. Also ask him to hold his white cane in another hand, so that the others who are driving or walking along will know that the person is blind and they will take adequate precautions. So, what I want to tell you is blindness is not the end of life. I'm repeating myself. It's not the end of life. It is just a new life that is to be led in a different way, in a more fulfilling way. I always believe that, God does not leave anybody unattended. I have been blessed by, God's presence practically every day. Somebody or the other helps me in one way or the other, and that is God. So please do not disappoint any patient if he or she were to lose his or her sight. But if it's a child, ensure that he or she gets educated, refer him to proper organization, or if he's an adult, insist that he takes appropriate training for his rehabilitation and joins the job that he was doing earlier. sometimes I see a CA has been asked to do some clerical job because he has lost his sight on a computer. That's most ridiculous. A CA can be still a CA despite his blindness, because now there are technologies available. For instance, I am talking to you on a Zoom call. I have no sighted help here. I've connected myself. So we use computers, we use phones, and we use them for everything from banking to social media to everything. So just in conclusion, I want to say that this is a new phase of life. We also live it in a very colorful manner and enjoy it to its fullest extent. At the end, greetings for Dussehra tomorrow, and I thank Sankara Academy for giving me this opportunity to address y'all, and I'll be very glad to respond to any questions. Oh yes, and of course, just as I leave, many people have this curiosity: do blind people dream? Of course they do. And the only difference is many of us who are born blind will have audio dreams, no sight, but those that have lost sight, and most of us become blind late, do have dreams with visual features. And those who have lost their sight late also possess color memories, which people like us who are born blind may not have. Thank you, friends.
Hi, sir. I have a couple of questions for you, if you could answer them. Yeah.
Sure.
Yeah. So we come from a hospital setup. So how should a doctor and an optometrist speak to a parent or a child when they find maybe blind?
I would say that when a parent is approaching you, and when you know that now nothing can happen, you will have to tell the person very, very upfront, frankly, but of course in a very polite manner, that, well, we could have done, we've done what we could have done, but this is the situation. Having said that, nothing is lost. The child or the person can still be educated very well. You could also give examples of blind people whom you know who are successful, and try and connect parents with that blind person, so that the parents also are feeling heartened. And for God's sake, don't make euphemistic remarks, specially able, no, now God has given you some special abilities, or you are differently abled, oh God, and you are visually challenged. Because there is no special ability that he or she possesses. Okay, I mean, if this was the case, then why everybody would not have special abilities? So let's not be euphemistic. Let's be realistic, but maybe in a very polite and soft way.
Thank you,
Yes.
sir. Thank you for letting me know. What are your hobbies like, sir?
Oh, that's a good question. I love reading all kinds of books, especially sometimes even fiction. My favorite genre is biographies and autobiographies. I also have interest in politics, including international politics, because that's where I have my studies. I've done my master's in political science. Listening to a lot of radio and using technology to the best of my abilities, and yeah, even chatting and meeting people, making friends, hobbies like any other person would have, having social connections, definitely.
Good to know, sir. Sir, one more question. Like, how do you manage to use technology? Say, how do you use a smartphone?
Smartphone, every smartphone, whether it's an Android phone or an iOS phone, has setup made available, which is called accessibility. If you go to your settings, so in that there is a setting called voiceover in iPhones and talkback in Android phones, which reads out the matter that is present on the screen. So we operate phones using screen readers. and computers also. We use screen readers. The only thing is that the apps and the websites and the programs have to be developed in a particular manner so that they are accessible for screen readers. And there are guidelines available created by Worldwide Web Consortium for making apps and programs accessible for people with disability. And for low vision people, there are magnifiers available both on iPhone and Android phones. In fact, Apple has in fact now developed a separate feature for magnification. So it's a wonderful thing. And in fact, technology equalizes us along with other people.
Sir, one more question. We post a lot of content in social media, say Facebook. So tomorrow, if I want to post something about this video or the YouTube streaming that we have done today, what are the tips for us to make it easy for the blind people to access it or make use of it?
You can know. So video people can know because there is a link given. So that will not be a problem. If you're posting a photo, there is something called alt text where you can describe the photo. In fact, Facebook gives us that opportunity now to describe photos so that you can put alt text so the blind person will know what photo he or she is, on. In fact, now there are apps available on mobile phones which also allow us to explore the photo with our fingers as to what is where. So it's one of the apps on iPhone is called Seeing AI. AI is artificial intelligence, and it's developed by Microsoft and one of the best apps, according to me, for these purposes. And we also use Facebook and YouTube and Twitter and everything else. Some of my friends also use Insta. I somehow have not got comfortable using Insta yet, but many of my younger friends do use Insta.
Okay, good to know.
That's wonderful to know, sir. This is Dr. Soumya here.
Yeah,
got a real great insight into through your talks and the answers that you've been giving. I had this very sweet child who comes to me for consultation. The child had a little vision to begin with. Now with the glaucoma progressing, she's nearly blind. So she was going to a regular school earlier. Now she shifted to a school learning Braille. She's a 9-year-old child. So what are the tips that you would give me as a doctor that how do I address her?
Where is she based out of? Where is she based out of? Is she in Bangalore?
She's based out of Bangalore. Yeah.
Then, first and foremost, I would request you to approach an organization that does inclusive education and put the child back into a regular school. I am not in favor of child going to a special school. Braille, etc. has to be learned. I totally agree. That can be taught separately. So if you can be in touch with me offline, I will talk to you. And see, you can address the child with her name. You need not remember and call all the time that she's blind and all, obviously. So that's okay. That's nothing wrong.
Yeah.
And but please, I would request you that let the child go into a regular school. It's not advisable now to send a child to a special school. Their level is not as good as the regular schools. So, and also what happens is children tend to get excluded from society. You see, when you are out of sight, you become out of mind.
Exactly. That was what was suggested to the parent to put her in inclusive education. But when she came for 6 months follow-up, I realized that the child is put into a learning Braille. So that was a shocker for me.
No, Braille can be learned, doctor. Braille can be taught in an inclusive environment.
Correct.
So if you can be in touch with me offline, you will get my number from Dr. Kaushik, etc. I would be very glad if this child gets educated in a regular school, please, because she must develop ambitions. I don't want some child to just be a music person. I am not against music. I love music. But having said that, I don't like those stereotypes.
Exactly. So could you give us some links onto where we could share it with our parents of these children to get into to understanding more about this and exploring more opportunities.
That is exactly why I told you if you can get in touch with me offline.
Perfectly, sir.
Incidentally, I would also anyways want to get in touch with you offline because I want to know more about aneuphthalma. It's a very mysterious thing for me, actually.
Okay.
Sir, one last question. So you spoke about IPL. So who are you supporting in IPL this time?
That's my favorite team got knocked out yesterday. I was wanting Delhi Capital to win only because I like Rishabh Pant, and I don't know why they don't play Steve Smith. I know one thing, that I would not be happy if Chennai Super King wins, although they are more likely to win.
Thank you so much, sir. Thank you so much for the wonderful
Thank
insight.
you.
Thank you.
Thank you.
Friends, we all love our eyes and we rededicate ourselves to this World Sight Day to ensure that we work to eliminate blindness. And to those with the irreversible blindness, let us ensure that they lead a life with dignity. Subscribe to our YouTube Shankara Academy of Vision channel to be updated on future live streams and uploads. Thank you so much.